So here is just a quick little video of everything that I put in my nursing bag as a third semester nursing student. Here is my bag, and I think I got it on Amazon, but honestly I wouldn't recommend it because the zipper has broke like 4 times. So buy a better quality backpack than I did. I have this little pocket in the front which is really nice, and it's got some erasable pens. I got these at Target and they're so nice because all of my clinical paperwork has to be in pen. But if you make a mistake, they don't want you to scribble it out or it looks really messy. It's a big thing. So these ones with the little eraser on the back are so perfect for clinicals. And if you do get the erasable pens, also get different colors. Oftentimes professors will have you write in 2 different colors of ink for 2 different days. I've also got my Owala, and as a hospital girly, this is a must because I don't know how these girls are running around here with their Stanleys and their straws exposed to everything. I don't know about you guys, but I do not want my straw exposed to the outside air. Like, I know people have those little grippies now where they can put them over top of the straw. Just get an Owala. They're cheaper, they're cuter, and your straw's covered, so. And they come in cute colors, so that's fun too. So the first thing I've got in here is my stethoscope case. I did get my stethoscope as a present for Christmas, and it was quite a bit of money, and stethoscopes are quite expensive, so it's good to take care of them properly. So I've got it in a nice little case here. There she is. She's beautiful. I actually bought this cute little charm to put on my stethoscopes. I don't know if you can see, but it's a cat, and it looks like my cat, so it's perfect. Also, anything with stethoscope charms and stuff like that, it does have to be something that you can clean easily. You can't use cloth or things like that because they're not clean, and you need to be wiping down your stethoscope frequently, making sure that that's clean so you're not spreading stuff to different patients. I've also got my watch, and you need to make sure when you're buying watches that you have one with a second hand so you can count respirations and things like that. Another thing you should have is the pen light. I don't have mine in my bag right now, but also you'll need some bandage shears. Actually, I don't know. I feel like you could pass on the bandage shears and just buy a smaller pair of normal scissors, just because who wants to carry around those big scissors in their pocket all day? Like, I don't, honestly. Like, it's in my bag, but I don't want to carry that in my pockets. I have limited pocket space anyways, so. I also recommend having a little notepad or sticky notes. I've got some just simple sticky notes. Those are perfect. I'm always writing things down, whether it be on my gloves or just taking notes all the time. I've got a million books. So this is my care plan book, and it's so heavy. This book is for all of our diagnostics and tests. A lot of times you'll hear doctors talking to patients about different medical diagnostics and different testings that they're doing and surgeries, and this gives a really good explanation of all the things in there. This is my drug guide, so it's really helpful when I need to look up a medication really quickly for a patient. Yeah, it's really helpful. This is another thing that I got off of Amazon, and it is so nice. It is a clipboard that folds up into your pocket, and I will just put all of my paperwork in this little clip here and fold it up and take it with me. It's also got some different conversions written on here, and it's got some stuff about EKGs, pupil sizes, things like that. So it's a nice little resource to have. You can find them on Amazon. They're pretty cheap, and they come in lots of fun colors too. I also always carry hair ties and Tide sticks just because somebody always needs those, and it's nice to be that person in the clinical group that has everybody's back, so it's nice to carry those things. I like to put them in a little packet together with other things like feminine hygiene products, stuff like that. Even a hairbrush and floss are nice things to carry. You never know when you might need them. I use my extra stick of deodorant all the time, just because it gets really hot in different settings for my clinicals. I was in long-term care in the middle of the summer. It was so hot. I was reapplying deodorant like every 20 minutes. It was so bad. Okay, that's maybe exaggerating a little bit, but it was a lot, and I was very glad that I had an extra stick of deodorant, and I think all my patients were glad that I had an extra stick of deodorant. I also pack quite a bit of snacks in my bag, so a granola bar and just things that are high in protein that'll keep me going throughout the day. I also keep an extra pair of scrubs in my bag at all times, just because you never know what's gonna happen. And along with scrubs, pack an extra pair of socks as well if you have room in your bag, just because nobody likes to deal with gross socks after you spill a urinal or something like that. So that's all I have for my video today. I hope this was helpful for you guys, and let me know what semester of clinicals you guys are in and what area you're in right now. Right now I'm in acute care, so it's been a really fun learning experience. Alright, bye guys!